Welcome to the deep dive. This time, we are tackling a public health mystery. So picture this. You're in Western Florida, right after Thanksgiving, and you're a doctor. And suddenly your ER is just swamped with patients who all have acute gastroenteritis. We're talking vomiting and diarrhea, just a whole 9 yards. Not a good way to start the holidays.
Oh, yeah. And it's not just your hospital either. Multiple facilities across the region are reporting this same sudden spike in cases. Something's definitely up.
Right before you start prepping your house for quarantine, though, let me clarify.
Okay.
This is a fictional case study. It comes from the OpenStax Microbiology textbook. You can find a link in the description. But it's a great way to learn about how real-world disease outbreaks are investigated and how they are contained. Consider this your crash course in epidemiology.
Yeah, these fictional cases are actually carefully crafted to mirror real outbreaks. It gives us a safe space to learn and analyze, even make mistakes, without the real-world stakes.
Okay, so let's dive into the details. This case study starts by laying out the initial symptoms and the outbreak's timeline. Over 250 cases in just 2 weeks, right after Thanksgiving. What are your initial thoughts? What could cause a spike like this?
Well, the timing is incredibly telling. Thanksgiving feasts are known for their abundance and variety, which unfortunately also means more opportunity for things to go wrong. Foodborne illness is definitely high on the list of suspects, especially with those gastroenteritis symptoms.
Right. But food poisoning isn't the only possibility, is it? Couldn't it be like a contaminated water supply? Or even a new virus?
Oh, absolutely. You have to keep an open mind in these early stages. Epidemiologists, they don't jump to conclusions. They gather evidence, and then they narrow down the possibilities.
And that's what they do in this case.
Yeah.
The case study says that hospital labs identify the culprit, and it's Salmonella bacteria. That's when the real investigation begins.
Yeah, Salmonella is a frequent offender when it comes to foodborne illnesses, so that finding definitely helps focus the investigation. Now the question becomes not what's making people sick, but where does this Salmonella come from?
Right. And the case study highlights some details. They might seem trivial at first, but the age range of those affected is really broad, from young children to seniors over 80. And then the cases are almost evenly split between men and women. Sadly, there were 3 deaths, all linked to pre-existing conditions and delayed medical care.
Those details are anything but trivial. They provide crucial insights into the outbreak. That wide age range and gender distribution suggests that this isn't limited to a specific group or location, like a school or workplace. And the deaths, while tragic, they underscore how severe a Salmonella infection can be, especially for people with underlying health issues.
So it's not tied to a specific group or place. So that means this is probably a common source outbreak, right? Something a lot of people were exposed to.
Exactly. That's a critical piece of the puzzle. And that's where the investigation takes its next turn. Epidemiologists decide to interview a random sample of patients to try and pinpoint that common source.
Now, why interview a random sample? Instead of interviewing everyone, wouldn't more interviews mean more information?
Well, it's a matter of practicality and efficiency. Interviewing hundreds of people would take forever, and you might not even get more useful information than from a smaller random sample. This way you get a representative snapshot of the people who are affected, and you can identify trends and patterns without getting bogged down.
Makes sense. So what kind of questions would you ask these patients if you were in charge of the investigation?
Well, considering the outbreak seems to be from a common source, and knowing that Salmonella is the culprit, I would focus on food. I would want to know, what did they eat in the days before they got sick? Did they share any meals with others? Were there any common foods or dishes among those who got ill? This line of questioning is where things start to get really interesting.
Okay, so the case study says that the interviews zeroed in on what people ate during Thanksgiving dinner. They asked these really detailed questions about every single dish, even down to brands of ingredients and where they bought the food.
That level of detail is crucial. Think of it like a jigsaw puzzle. Each little detail, each answer could be the piece that completes the picture and reveals the source.
And in this case, all those pieces eventually fit together, and they revealed a startling connection. Almost all the patients who were interviewed admitted to eating one particular dish. Turducken.
Now, for those who don't know, turducken is this extravagant holiday dish. It's a deboned chicken stuffed inside a deboned duck, which is then stuffed inside a deboned turkey. It's a culinary feat.
Yeah, you don't see turducken every day.
Exactly.
Right.
That's what makes this connection so important. Turducken is usually only for special occasions. Thanksgiving is prime time for it. This perfectly aligns with the outbreak timeline.
Yeah, it really does. It's like that final puzzle piece. clicking into place. The turducken's starting to look like our prime suspect.
The plot thickens. But we can't jump to conclusions yet. We need to do more digging to confirm this and to figure out where in the turducken's journey things went wrong.
That's where we'll pick up in part 2. Stay tuned as we dive deeper and uncover the source of this Thanksgiving outbreak.
I can't wait. Welcome back. So we've established the strong link between our Salmonella outbreak and turducken. Now the focus of the investigation shifts from what's causing the illness to how this festive dish became a source of illness.
Okay, so let's dig into that. The case study says that the turduckens all came pre-stuffed from a single processing plant, and they were sold under 2 different brand names at a regional grocery chain. It's all starting to come together now.
Yeah, it definitely seems like we're zeroing in on the source. This is what we call a common source outbreak. You have one single point of contamination affecting a lot of people, like a ripple effect spreading out from that processing plant.
And the case study then describes the next step. The Florida Department of Health notifies the CDC, and state inspectors are sent to the processing plant. I bet that's not a welcome sight for the plant manager.
Definitely not a good day at the office when the health inspectors arrive. But this is crucial to contain the outbreak and prevent it from spreading further. Time is of the essence in these situations.
So what did the inspectors find at the plant? The case study paints a pretty grim picture.
Oh, it's not good. They found a contaminated chicken processing machine. They found improper cleaning protocols throughout the facility. And the stuffing and packaging process, it was practically designed for bacteria to grow, basically the perfect conditions for a salmonella outbreak.
So contaminated meat plus ideal conditions for bacteria to grow, it's a recipe for disaster.
Exactly. And sadly, this is something we see in real-world outbreaks more often than we'd like. Food processing is complex, and when corners are cut or safety protocols are lax, the consequences can be really bad.
It's easy to just blame the processing plant, but there are often multiple factors at play here.
Oh, for sure. There's a lot of pressure on these facilities to meet demand, especially around the holidays, when everyone wants that picture-perfect turducken. And this pressure can lead to shortcuts. Sometimes it's unintentional, sometimes not.
It's a good reminder that there's a human element to all of this. Real people are making these decisions, working under pressure, trying to do their jobs.
And we also can't forget about the responsibility of the consumer. We often think that food safety is someone else's job, but we play a big role too. It's not just about washing your hands before you cook. It's about being mindful of how you handle and prepare food, especially something complex, like a turducken, with all those different meats and stuffing.
Are you saying that preventing an outbreak like this involves this chain of responsibility, from the processing plant to the grocery store, and then finally to the person preparing the food at home?
Exactly. It's a shared responsibility. If one link in that chain breaks down, the whole system is compromised.
So could this outbreak have been prevented? Or are these things just unavoidable?
It's impossible to say for sure, but there were definitely opportunities to intervene, maybe more rigorous and frequent inspections at the processing plant. Could have caught the sanitation issues.
Yeah, and maybe stricter regulations about the stuffing and packaging could have stopped the bacteria from growing.
Exactly. And for consumers, clearer labeling. And better education about safe handling and cooking poultry. That could have made a big difference.
For prevention is just as important as the investigation.
Absolutely. And that's where epidemiology goes beyond playing detective. It's about understanding why diseases happen and then developing ways to minimize the risks.
So what does this mean for the average person? What can we do to protect ourselves from foodborne illness?
Well, the most important thing is to be aware of food safety practices. Wash your hands before and after handling food. Cook meat to the right temperature, store leftovers properly, basic things, but they can make a huge difference.
And be extra careful when you're preparing things like turducken, where there's more potential for cross-contamination.
Definitely. The more complex the dish, the more chances there are for something to go wrong. And if you do get sick with symptoms of foodborne illness, see a doctor right away. Early intervention is really important.
This has really been eye-opening. You know, a simple case of food poisoning can tell us so much about food safety and public health.
It's all connected. And this fictional case study really gives us a valuable look at how these outbreaks happen and how we can prevent them.
So what happened to the processing plant? Did they face any consequences besides being shut down and having to recall their products?
That's a great question. A salmonella outbreak this big can have a serious impact on a business. It costs a lot to shut down and to recall products and to deep clean everything. And then there's also the potential for lawsuits.
And their reputation probably suffers too. People might not want to buy their products anymore.
Yeah, consumer trust is hard to earn and easy to lose. And an outbreak can really hurt a company's brand and sales, even if they try to fix things.
It really shows how important it is to prioritize food safety. At every step of the way. It's not just about following the rules. It's about protecting people's health.
Right. It's about being ethical and running your business responsibly and recognizing that the decisions you make affect people's lives.
So this outbreak was limited to Florida. But foodborne illness is a problem everywhere. What are some of the challenges when it comes to food safety on a larger scale?
That's a big question. It's something that keeps a lot of experts up at night. We're dealing with these increasingly complex food supply chains. Food travels so far these days, crossing all kinds of borders, involving so many people.
Which creates a lot of opportunities for contamination.
Absolutely. And it makes it harder to trace outbreaks back to their source. We also have to consider climate change. Warmer temperatures make it easier for bacteria to grow, so that adds another layer of complexity.
So what are some of the solutions to these global food safety concerns?
Well, there's a movement towards stricter international food safety standards. Organizations like the World Health Organization and the Food and Agriculture Organization, they are working to develop guidelines that can be adopted globally.
That sounds promising. What about technology? Are there new tools to improve food safety?
Oh, yeah, for sure.
Yeah.
We're seeing a lot of development in blockchain technology. It can help track food throughout the supply chain, more transparency, more accountability. It could be a game changer.
It's like giving each food a passport. So you can see exactly where it came from.
Exactly. And there are also better ways to test for pathogens in food that could help prevent contamination in the first place.
It sounds like we're making progress, but there's still a lot to do.
Absolutely. Ensuring food safety is an ongoing challenge. We need to keep working together to make food safer for everyone.
So where do we go from here? We've talked about the outbreak and the investigation and preventative measures and the global implications of food safety. What else is there?
Well, I think we've covered the main points, but there's always more to learn. This case brings up a lot of interesting questions. What stood out to you? What are your takeaways? What questions do you still have?
It's wild how easily this could happen. It really makes you think about food safety. Like, we can't just assume our food is safe.
Yeah, it's easy to think that the food we buy is always going to be fine. But this case shows us that there are some weak points in the food system, and it's a system we all depend on.
And it's interesting how this case, it's made up, but it's still based on real science, real epidemiology, and how these outbreaks happen.
Yeah, it's like a simulation. We get to be detectives, figure out where the outbreak came from, and even think about ways to prevent it. It's a great way to learn.
So we saw how one little incident at a processing plant can cause problems for so many people. Across an entire region, makes you wonder how many other outbreaks might be out there.
Yeah, that's something that public health officials worry about all the time. It shows just how important it is to be careful, both for the people who make the rules and for regular people like us. We can't just assume everything is fine. We need to be informed and aware and proactive.
So what can we do as individuals to make the food system safer? Besides the obvious stuff like washing hands and cooking food properly.
Well, we can be more aware of where our food comes from. Supporting local farmers often means shorter supply chains and, more transparency. We can also push for stricter food safety rules and make sure companies are doing the right things.
So it's not just about what we do at home, but also about working together to change the system.
Exactly. And don't forget about education. The more we know about food safety, the better choices we can make.
Okay, so if there's one thing to take away from all of this, what would it be?
For me, it's that food safety is everyone's responsibility. From the farms to the processing plants, to the grocery stores, to our own kitchens. Every step is important. We all have to do our part to make the food system safer.
I love that. And it reminds us that even though this case was made up, the things we've learned are real. We can use this knowledge in our own lives to make better choices and to push for a safer food system for everyone.
Absolutely.
And on that note, I think it's time to wrap up this deep dive.
Thanks for joining us.
And as always, we encourage you to keep learning about this stuff. Check out the OpenStax Microbiology textbook. There's a link in the description. Until next time, stay curious, stay safe, and bon appetit.